recording now. And I will pass things right along to the moderator of today's event on elder abuse, incidence, and prevalence. Today's moderator is Andy Mao, and he's the Senior Counsel for Healthcare Fraud and Elder Justice at the United States Department of Justice. And I'd also like to point out what I think is an equally impressive credential is he did his undergraduate work at Cornell University, and go Big Red. That's my alma mater as well. Take it away, Andy.
I knew there was something I liked about you, Jim. I can't put my finger on it. Well, thank you, Jim. Thank you to the Kennedy School and to the National Institute of Justice for organizing this webinar. And also thank you to all the participants who took time out of their busy schedules to participate as well, especially those that may have had to overcome snow as we have in D.C. I've got to say I'm grateful that, although I'm not grateful that you have to see a picture of me, I am grateful that I am in a suit, given the fact that I had to come downtown. I'm in jeans, boots, and don't look anywhere near as professional as I do in the picture. But again, thank you for all that are participating. Obviously, the topic of this afternoon is to focus on the incidence and prevalence of elder abuse, neglect, and exploitation. Sadly, it doesn't take anything but opening up a local paper with any degree of regularity to know that these are problems, that they occur locally and that it's likely to be a nationwide problem. But in order for policymakers and decision makers to be able to effectively develop policies and to make decisions on how to address these issues, a critical piece of information has to be a more sound, empirically based measurement of the incidence and prevalence of elder abuse, neglect, and exploitation. And we're here today to discuss a recent nationwide study that was done by Professor Ron Acierno and discuss what that study showed and the natural sort of implications of that study in advancing our efforts to combat those issues. I'm very, very pleased to be moderating this panel of three incredibly distinguished panelists. The first is Georgia Anetzberger. Georgia is a pioneer in the area of elder abuse research, authoring over 30 works on elder abuse. She's an adjunct professor of medicine at Case Western Reserve University. She's a co-editor of the Journal of Elder Abuse and Neglect and has spent over 25 years addressing issues of elder abuse, first as an APS worker, and then as a researcher, administrator, and most importantly, I think, as an educator. Also in the panel is M.T. Connolly. She's a senior scholar with the Woodrow Wilson Center in Washington, D.C. She's the director of Long Life Justice, a strategic advocacy group housed in the National Office of the Appleseed Group. She was the founder and my predecessor at the Department of Justice as the coordinator of the Elder Justice and Nursing Home Initiative. She is one of the sort of original key architects of the Elder Justice Act, which passed last year as part of the Affordable Care Act, and is one of the broadest thinkers on these issues and how to combat them. And last but certainly not least, we have Professor Ron Acierno, who is a professor of psychiatry at the Medical University of South Carolina, where he's also the director of the Older Adult Crime Victims Clinic. And Ron is the lead investigator of the nationwide elder mistreatment study that we'll be talking about this afternoon. And since you're obviously here to hear from the panelists, I'll turn it over to Ron, who will be giving an overview of this study. And so, Ron, take it away.
Okay. The first slide I think everyone can see is my research team. These are the collaborators, and under the direction of Dean Kilpatrick, who pioneered this sort of methodology with younger adults and adolescents, and we modified it and applied it to older adults. Let me see if I can advance the slide here. Okay, here we are. My panel advised me, and I think it's good advice to sort of tell you what I'm going to say it, and then tell you again. So these are the take-home points. First of all, this was a national community sample, so these are not nursing home patients. These are community residing independent older adults, age 60 and over, and the prevalence was a little bit higher than you might expect. This is a one-year snapshot, and we also did since age 60, but one-year snapshot of emotional, physical, and sexual mistreatment was 6.5%. And that goes up if you add neglect, which is a little bit harder to define, and we'll talk about that if we have time. Another finding that was interesting was a lot of the elder mistreatment was actually domestic violence. It was actually perpetrated by spouses, and it seems that we need to really look at domestic violence when it's not stopped as an ongoing problem. Just because you get older doesn't mean that communication, interaction, or relationship style changes. And these data really supported that disappointing finding. But on a positive note, we found that social support appeared to be protective against mistreatment. And that was very encouraging and dovetailed nicely with our other post-disaster research, which found that social support in older adults is protective against anxiety disorders and mood disorders. So it's protective against both a bad thing that can happen and the consequences of the bad things that happen. So we'll talk more about that. But not to bore you, but to give you just a methodological overview, we used random digit dialing methodology. The alternative of doing either in-person or in-person computer-driven survey methodology was sort of as a first step in a prevalence study far too expensive. And also, we're not sure we would have reached the upper and lower ends of the socioeconomic status as well as we did with telephone survey. And this got about 96% of the older adult population, considering people who don't have phones and people who have hearing problems. So that we lost about 4%, but we think we have a good sample. The interviews were computer-directed, meaning in a tree of questions, if the first few questions show that the rest would be irrelevant, the section was skipped so that people weren't bored to death by irrelevant questions. And there were two languages, English or Spanish, and the cooperation rate, as I found with my other older adult research, was pretty high. It was 69%, which is why I like to do research with older adults. They're much nicer than young adults. The sample that we got, as I said, was almost 6,000, age 60 and over. About 60% women, average age around 70, although we had a nice wide range. A little over half married or cohabitating. A significant number were widowed. And the racial distribution is pretty similar to the population for that age group. I'm going right into the findings. The two bars here, the shorter ones show past year, and the longer, taller ones show since age 60. So these are both indices of elder mistreatment. And one is just the past year since the survey was done. And this is emotional mistreatment, and I can get into the definitions later. Well, I'll just basically these focused on psychological or verbal abuse. And importantly, we looked at mistreatment by any perpetrator. First, we defined it very objectively. Has this type of thing ever happened to you? And if they said yes or no, then we asked who did it. And that allowed us to get both stranger violence and caretaker or spousal violence, because it makes no sense to look at elder abuse and not elder assault if one is a risk factor for the other. So just going off here, men are on the left, women are on the right, around 4 to 5%. So similar numbers were psychologically, verbally, or emotionally abused. Looking at who was doing it, well, that partners were about a quarter in men and about that in women, and family members who weren't the partners accounted for a large proportion as well. So about half of this emotional mistreatment is happening in the home. Strangers, very small percent. Surprisingly, though, particularly for men, a lot of individuals were being verbally or psychologically abused by acquaintances. And what we did was we looked at a bunch of risk factors and then put them in a logistic regression to control for one another, just to see what would be most important. And lower age, so the younger old had more emotional mistreatment, and being employed, which we thought was going to be protective. So apparently people are not being nice to each other in the workplace, particularly for men. Prior traumatic events mean something horrible has happened to you in the past. That probably speaks to a person's environment or geographical location. There's low social support and needing help with activities of daily living. So basically, these are the emotional mistreatment risk factors. Now, moving to the next mistreatment type, so we have time to talk about these things. Physical mistreatment. These were events that would have been defined as assault objectively by most state legal definitions. Again, very similar distribution, less than emotional or psychological mistreatment, but similar between men and women. Who's doing it? Look at the level of partner abuse in women. 70% of the physical violence in the past year was perpetrated by partners. Domestic violence, once established, does not appear to diminish. Strangers are a tiny percentage. And even for men, partner violence is more than a third. So domestic violence is a problem of in dating relationships, young relationships, that's true, and now we can say also that it seems to be a problem in older adult relationships. Now, what are the most important risk factors? Well, again, the young or old, and the one that comes up again, the one in red, are significant, low social support. Can't do anything about age, but we can do something about social support. We'll talk about that in a few minutes. Okay, let's see if we can go to sexual mistreatment. This was, thankfully, a very low base rate event. Twice as many women as men reported this, but it was extremely low base rate. Who's doing it? Well, it's not the strangers. Sexual violence by partners is another form of domestic violence, and we see that again. We also see a pretty high rate of acquaintance sexual assault and sexual violence as well.
Ron, when you talk about acquaintance, can you define how you define acquaintance for the participants?
Okay. An acquaintance was somebody who was not related to the person, but that they knew either extremely well or somewhat well. So this would be a neighbor, a person that they see frequently and know by name, but not somebody related or in a caretaker role.
Great, thank you.
These are sort of incidental interactions. There were so few sexual assaults that we did not break it out by, we did not do a logistic regression, but these were the individual risk factors. So some of the same players as came up before. But just to tie all these numbers together, because the numbers are sort of, I guess, basic and boring after a while. About 1 in 17 older adults reported this in the past year, and if you go since age 60, it's significantly higher. And if you consider neglect, now neglect is having a need, for example, getting to the doctor, getting food, having somebody repair a damaged roof that is causing danger to the house that no one was meeting. Those numbers go to about 1 in 10. This doesn't even count self-neglect. A lot of this mistreatment is focused in the home, and a lot of it, and remember, these are community residing adults, and a lot of it is not by children, but by spouses. And we may really need to prompt our domestic violence domestic violence co-workers to focus on older adults as well. Finally, there are some differences between men and women in terms of risk factors and prevalences, and that indicates that maybe we need to develop different interventions. We can't just say we're intervening with elder mistreatment. For women, obviously, domestic violence is a significant issue. For men, workplace violence might be a significant issue. But one finding that was repeated across everything was social support. If a person felt connected to their community and felt connected to others around them, they were far less likely to be victimized. Andy, did it get any better when I got closer to the phone?
It did, thank you. Ron, one question that came up was whether or not you looked at financial exploitation, which I know you did. Could you talk a little bit about that as well?
Yes, I purposely left it off of here hoping no one would ask about it. No, the problem of financial exploitation, which might be the most prevalent problem, was, in my mind, we have to refine, and I'll be refining the measures in a follow-up study for this. It's a moving target because one of the important aspects of financial exploitation is misuse of funds. And there's a gray area when someone is helping you with your funds versus abusing them. So one of the things we ask is, did somebody spend your money without telling you? Or did somebody spend your money without giving you receipts? Did somebody invest your money in a way that was inappropriate? These are all aspects of financial abuse. If you consider financial abuse, and let me just, we do have some supplemental slides. If you consider financial abuse, the rates have to be distinguished between financial abuse by strangers and financial abuse by family. And it's, again, very hard to define, so I sort of shy away from answering it, because is a bad investment financial abuse? Well, obviously theft, when somebody takes money out of your wallet, is. But what if somebody spends your money and doesn't tell you, and what they've done is they've paid your rent with your money, they've put groceries in your refrigerator with your money, and they didn't buy anything for themselves? Well, they spent your money without your permission, but they did it in so far as taking care of you. So it's a problem that this study addressed somewhat. It sort of peeked the surface, but I don't want to go too far into risk factors. But I'll just throw out a number there. When you added financial exploitation into our numbers, we went from 1 in 10 of adults showing elder mistreatment to closer to 1 in 8 or 1 in 7. So it's definitely out there, and it's something we need to refine in terms of our measures next time.
Ron, one methodological question that's come up is, did your study interview individuals with dementia, and if so, how did you interact with those participants?
Okay, this study was specifically focused on community residing independent adults who were not suffering from dementia. So we wanted to get a snapshot of people who were not either in nursing homes or could have been nursing home residents that were just maintained at home. A part of it was to clarify the population. The other part of it was to protect human subjects in research. And so you had to be able to consent and understand what the study was about without, beyond any doubt, in terms of the interviewer who was asking you questions. So this is just community residing independent adults, and I think that the numbers are sort of given that. The dementia-suffering adults are the highest risk group. The fact that we still got 1 in 17 reporting past year mistreatment, and that's community residing adults, it's a little bit disconcerting. The rates were pretty high for community residing adults.
When you began this project, did you have any sort of working hypotheses about how this would shake out? And what, if anything, was the most surprising result on the back end in terms of what you actually found?
Well, we really wanted to. It hadn't been done before. We had we did a similar survey with adults aged 35 and older about 20 years ago. And in that sample, we had 560 older adults. That was only women, and we only had 560 older adults. So we had a guess about the prevalence in this population. But we really didn't think that the existing prevalence studies out there asked enough or comprehensive enough questions. A lot of them that had recently come out were add-on studies. They weren't a study of mistreatment per se. So the most surprising thing, quite honestly, was the high number we thought we got for past year. We thought we were going to have to only look at since age 60, so covering a wide number of years. But when we looked at past year incidents, the numbers were still high enough to support our statistical analyses and identify risk factors. The other thing that was very surprising to me was the high rate of spouse-perpetrated violence. And the final thing that was exceedingly interesting to me was the fact that social connection seemed to protect against mistreatment, because we found that in our research on post-traumatic stress disorder and anxiety and depression that it protects against that. You probably don't need $1 million study to figure that out. We didn't know that extended to mistreatment itself. Even though I guess it's obvious if a person's connected and there's more eyes on a person, their neighbors, their friends, their family, then people are less likely to do bad things to them. And we knew from the past research that social isolation was a risk factor. So what we didn't expect was how consistent across all mistreatment types social connection and support was going to be. And that's sort of a nice thing because it gives us a very concrete first step for intervention. And that is addressing connection issues, most clearly of which is probably transportation, and particularly for older adult women who may have relied on their husband for a lot of the transportation if he's passed.
Great. Before I turn it over to Georgia for her views and comments, Jim, a couple of people have asked, or at least one person has asked, whether or not they can access Ron's study, and at some point, if you could post the link to the NIJ website where they can access this, that would be great.
Yeah, I'll get that up on the NIJ website gives the financial abuse numbers as well, and it gives a very detailed report of all risk factors and prevalence breakouts and things like that.
Great. Thank you.
I'm sorry. At some point during the Q&A, when we're not showing visual aids, I'll call that up first thing, and so they can see where they're supposed to go.
Super. Thank you, Jim. Georgia, if I could turn it over to you.
Thank you, Andy.
Georgia, are you still there?
Yes, I am. I was just trying to get my slides up.
Okay, thank you.
Congratulate Ron. I think it's such an important study, and it has such huge implications. I've been asked to talk about the practice implications of Ron's study, and the way I'm going to format that is I'm going to take each one of his major take-home points and talk a little bit about it. And I have to say, overall, in looking at those take-home points, it really does challenge those of us that are in active programming interventions overall in terms of what needs to be done and how much is lacking at this point in time. And I want to start with his first point. His first point suggests that elder mistreatment occurs really twice as frequently as previously thought. Last year, the Health Policy Institute of Ohio decided to take a look at family violence overall in terms of its prevalence. And so it looked at a variety of national prevalence studies, including Ron's, and then did some comparisons of child abuse, elder mistreatment, and intimate partner violence. And what was significant coming out of that is whether you look at Ohio or whether you look across the country, elder mistreatment occurs twice as frequently as child abuse and just slightly more frequently as intimate partner violence. And yet, in terms of interventions, we're not nearly where those other two family violence forms are at. I think there are three reasons for that. First of all, there's less heightened public and professional concern around elder mistreatment compared to the other forms. And let me just give you a quick example of that. Over the past decade, on several occasions, I've attended the International Conference on Violence, Abuse, and Trauma that's held in San Diego. And this particular conference tries to highlight all the different varieties of family violence, including elder abuse. However, only the sessions on elder abuse are poorly attended, and the only way you can get people to attend and listen to the topic of elder abuse is when somehow that particular subject is integrated in terms of the other forms of family violence.
Georgia, some of the participants can't hear you very well. Could I trouble you to speak a little bit more loudly?
Okay.
Thank you.
The second problem in terms of elder mistreatment in comparison to the other types of family violence is that there's relatively resources in terms of interventions to deal with it. MP Connolly, who's going to be speaking in a couple minutes, anonymously helped to write a background paper for the introduction of the Elder Justice Act back in 2002, and subsequently it was published in the Journal of Elder Abuse and Neglect. And among other things, the article offers a kind of comparison of federal funding directed to fight elder abuse versus that directed to fight child abuse and intimate partner violence. And of the estimated $7.4 billion that was available and used from federal sources at that point in time for family violence, 91% went for child abuse, 7% went for intimate partner violence, and just 2% went for child abuse. And I would suggest that despite the passage of the Elder Justice Act, as you mentioned, Annie, just a few minutes ago last year, there have been no funds appropriated to implement that legislation, so it's unlikely that those percentages have changed a great deal. And the last point I want to make in terms of this is we really don't know what works and what doesn't work in terms of dealing with the problem of elder mistreatment. Most of the major interventions in the field of elder abuse have never been rigorously evaluated. In fact, there's been very little research on elder abuse interventions overall. I think probably the best look at this was done a couple of years ago by Jenny Plug and her associates up in Canada, where they did an electronic database search to identify and then to analyze published articles and reports on elder abuse interventions. And they looked at over 1,200 abstracts. They identified only 173 that even dealt with elder abuse interventions. They found of those, only 8 of them constituted quality evaluative research. And of the 8, every one of them failed to reduce and in some instances actually increased the likelihood of elder abuse occurrence.
Hi, Georgia. This is Jim Cooney. I think the sound is still a little fuzzy for some folks. So if you could either get closer to your microphone or pick up the handset, that would help.
Okay, I'll pick it up then. How's that?
That sounds much better, yes.
Okay. The next major finding that Ron talked about is the fact that much of elder mistreatment is really spouse abuse. However, when you look at the interventions in this regard, oftentimes there are problems here as well. First of all, a lot of the domestic violence programs out there have been very slow to adapt to the needs of older victims. And let me just give you a couple concrete examples. Many emergency shelters are not handicap accessible. Many of them lack linkages to health care or other senior services. Many of them also don't take older men who might be seeking refuge from abusive situations. And finally, some of the domestic programs out there in certain communities fail to target older people in their outreach activities. Second point in this regard is we have had a tendency, both in terms of the public as well as professionals, to focus in on caregiver stress and burden as a more compelling explanation for elder abuse, and we have been less interested and less excited about power and control in terms of these situations. I think some of this is an historical artifact. If you go back to about 1981, the very first major congressional report on elder abuse, and it was titled Elder Abuse and the Examination of a Hidden Problem. Among other things, it gives a whole laundry list of potential causes for elder abuse, and then it sort of wraps itself up and says, but the overarching cause is really caregiver stress and burden. Well, that belief not only resonated with the public and professionals 30 years ago, it continues to today, even though there's a whole body of research that suggests the contrary. And the last point I want to make in this regard has to do with adult protective services in contrast with domestic violence programs, that they have very different histories and philosophies and approaches, and this can challenge their collaboration. And let me again give a couple examples. The origins of adult protective services really rest in the 1960s, continue through today, and it rests in multidisciplinary professional intervention led by social work. And this is quite different from what you find with domestic violence programs. The domestic violence movement began in the 1970s, and it was a grassroots movement that comes out of feminism. Secondly, adult protective services is modeled after child protective services, and therefore has an emphasis on mandatory reporting and the potential use of involuntary intervention, at least in certain select circumstances. And then by way of contrast, domestic violence programs stress the empowerment of victims, holding perpetrators accountable, self-referral, and then supporting the victim through her journey to safety, no matter how long that takes and no matter how many false starts there occurs. Ron's last major point has to do with social support and how important it is in terms of protecting against elder mistreatment. There are three problems I see here that have implications for intervention. First of all, at best, we have seen stagnant private and public funding for senior services. And in fact, during this current recession, things have become quite bad. Greater Cleveland, where I live, was particularly hard hit by the recession. And recently, I was involved in a survey of local senior service providers in our community, and we found that nearly all of them reported staff layoffs or salary reductions. They also reported, nearly every one of them, the elimination of programs or the shrinkage of service areas. I live in one of the older suburbs of Cleveland, and just last week, the community newspaper reported that that Office on Aging for that suburb receives a 31% reduction in its government funding and therefore eliminated several key services, including transportation, and I know Ron has emphasized that. In addition, our community has a long history of philanthropy, and we have among the largest foundations in the country. In fact, our Cleveland Foundation is the second largest community foundation in the nation. But here, too, available charitable dollars are going in other directions. And during the past year, we have seen the amount of philanthropic dollars for aging-related initiatives drop to just 1 to 2% of available resources overall. The second point I want to make in this regard is there are getting to be very few either formal or informal caregivers around to help support, care, or assist older people, not just now, but in the future. I teach a graduate course in healthcare administration at Cleveland State University, and it's on long-term care, and of course we look at the labor force for long-term care. And I've got to admit that our discussions are pretty gloomy in that regard. As I think most of us know, current shortages exist for practitioners ranging from geriatricians to nurses, from nursing assistants to home care aides, but we ain't seen nothing yet because those shortages are going to loom even greater in the future. In addition, in terms of family support, the aging baby boomers are going to be shortchanged in that regard as well. Unlike prior generations, baby boomers have had relatively few children, they've divorced more, they've moved around a great deal, and they've often put careers over family. And so both in terms of formal caregivers as well as informal caregivers, it's not the best of situations. The last point I want to make in this regard is that social connections of all types may be shrinking. Jim, I know this particular session is being sponsored by Harvard University, and back in 2000, a Harvard University professor by the name of Robert Putnam came out with a book that was really quite revealing in this regard, and it was entitled Bowling Alone. And it reminded all of us as Americans, and it includes older people, of course, in that regard, that we have become and are becoming disconnected from our family, our friends, our neighbors, our community groups. And Putnam warns us about this. He calls it a shrinking social capital and that it seriously threatens our personal health. I got to say, if I take a look at the magazine articles, if I take a look at the newspaper articles in any given month, I am bound to come across yet another study that echoes all of this. And I just picked up a couple in preparation for this particular presentation. The first one suggested that 35% of adults 45 and above are chronically lonely. The second one indicated that 1 out of 4 Americans has no close confidant. I'm old enough that I grew up at a time where I lived in a neighborhood where everybody knew each other, and people looked out after the children, and people helped one another out. And I live in a neighborhood now where I doubt that the majority of individuals know 2 or 3 of their neighbors, never mind be able to rely on them for help as needed.
Georgia, one question that, I'm sorry, why don't you go ahead? I'll let you finish first.
Okay, I just have 2 other quick things because Ron sort of ended by focusing on emotional mistreatment and physical mistreatment, and I just wanted to offer a couple perspectives on those. First, in terms of emotional mistreatment, as important as his research suggests that problem is, and it is an important problem, I would emphasize that in general, it doesn't get the serious attention it deserves. And I want to offer a piece of research I was involved in back in the mid-1980s to underscore that. Back in the mid-1980s, a couple of colleagues of mine and myself decided to do a qualitative study that attempted to determine the meaning and response to elder abuse across 4 ethnic groups and 2 different generations. And one of the surprising findings from that study was that overall, across all of those ethnic groups in both of those generations, psychological abuse and psychological neglect were considered the worst possible things that a family member could do to an older person, worse than physical abuse, than financial exploitation, worse even than sexual abuse. And yet, I would also argue that psychological mistreatment tends to be a secondary concern to those of us that are practitioners, that we seldom emphasize that in our look at elder abuse situations overall, and that it has not as much as those other different forms of elder abuse been the focus of our professional training, programming, or practice protocols. And the last point I want to make is in regard to physical mistreatment. And clearly, both from Ron's research as well as other people's, this is a problem that can have dire consequences to victims in terms of injury, pain, great suffering, even death. And yet, our community interventions to date have aimed more at problem response than prevention. I think this is kind of characteristic of Americans in general. However, we would hope for better in terms of elder mistreatment. And in that regard, I would suggest that Lisa Nirenberg's recent book, and it's titled Elder Abuse Prevention, advocates for something different and something that may be more advantageous to this field. And I say that both in terms of human suffering as well as the overall cost of intervention. Lisa suggests that we need to employ a public health perspective and approach to dealing with elder abuse, and that we need to, and I quote her, use surveillance and other types of studies to help achieve a clear understanding of the risk factors associated with abuse, to help identify the risk groups that we need to target in our outreach, screening, and development of services. And I want to just end by saying that this is not only a more humane approach, it is a better approach in terms of really getting at this very, very serious problem of elder abuse. It's clearly underscored by Ron's work, but it's also underscored by the work of many others.
Thank you, Georgia. Georgia, throughout your comments, we focused and touched upon domestic violence. And my question to you is, you mentioned before that elder abuse interventions have not been vigorously tested. And my question is, in the DV context, what was the sort of evolution of the development of interventions in that context? Was it linear in the sense that were there interventions tested and then implemented, or was it a messier sort of evolution in developing what we have today in terms of interventions? And in fact, are the DV interventions, have they matured to the point that they've sort of plateaued, or are they also still evolving? And what can we draw from those in the elder abuse context?
It's a great question. I don't know if I can fully answer it, but in a general sense, the DV interventions, you have to understand, came out of a grassroots approach. So they evolved less from a research undergirth than might be expected under other circumstances. They evolved rather in terms of the perspective of what made sense for victims and what made sense coming out of that grassroots feminist philosophy. Certainly, as we look at elder mistreatment as domestic violence in later life, a lot of those types of interventions and a lot of the philosophic underpinnings for those interventions make sense for us to adapt. On the other hand, the research directed at domestic violence programming, although it has evolved greater than it has for elder abuse, still has a ways to go as well.
Thank you. MT, you still there?
Yep, I'm still here.
Great.
Can you hear me okay?
Yes, we can.
Okay. Should I
Please
begin?
That'd be great.
Okay. Well, first, thanks very much to the Department of Justice and to the Kennedy School and Ron and Georgia and Andy and Carrie for hosting this. I think it's always really unfortunate when you have an important piece of research and it's a tree falling in the woods and it doesn't get the attention it needs. And really, the importance of research in this context is how it translates into practice and policy. So I'm thrilled that you're doing this, and I'm hoping that it's one of many such events. What I'm going to talk about today is, first of all, the importance of the work and for following up on some of the points that Georgia made. Then look at a couple of corroborating bits of research. Talk about some of the limits of phone surveys in terms of measuring elder abuse. Look at the policy landscape in terms of both the challenges and the opportunities that we have, and then looking at why translation of policy into practice and from research, going all directions, is so important. So, starting first with what Ron's study tells us. As Georgia said, it tells us that there's a lot of domestic violence and identifies some pathways to prevention, predominantly social support. As Georgia said, there's little assistance for older victims in general. The domestic violence, I think that Georgia, who is a much more polite and genteel person than I am, put it in her much more polite and genteel way, but really, the domestic violence and sexual assault programs have done very poorly by older victims. They haven't served the various populations who Georgia mentioned. And I was thinking, if this happened in the domestic violence movement, one of the advocacy capacities that they have is to bring lawsuits. And so what we have is a large network of infrastructure of domestic violence shelters, sexual assault programs, victim assistance programs, which by and large don't address older victims, and we've really not done much about that. So one of the policy take-homes is whether we should be considering some sort of strategic legal action, some sort of negotiation. You know, how do we address that? One of our colleagues, Bonnie Brandel, did a sort of back-of-the-envelope review, not a very scientific review, but of the 2,000 domestic violence programs in the country, only about 29 have older battered women's groups and have a definite focus on the needs of older victims. And as Georgia said, it's not only women victims. So that's an issue. I think that from a policy perspective, would benefit from some strategic thinking, analysis, and response. As to the other point that Georgia was making in terms of the different systems, one of the provisions that was originally in the Elder Justice Act but is no longer in there is to really try and take a look at the scope and range of frontline responders to elder abuse, which would include Adult Protective Services, the Ombudsman Program, victim assistance, law enforcement, health care, and then the other programs that we just talked about, and figure out what group of victims is appropriate for which one of those responders, and really try and take a more coherent and structured approach to that. Ron's points about social support, I think, are really critical because, as Georgia said, there's so little prevention research. And this really gives us a hint about an important area of potential prevention. I think we probably need more research, as Ron alluded to figure out exactly what types of social support are going to be effective in preventing elder abuse, and then work with our colleagues in the Aging Network, in social services, in the healthcare arenas, in faith-based organizations, et cetera, to figure out how we structure those kinds of preventive programs. We also need to know a lot more about what older victims need. We know precious little about that as well. So, from a policy perspective, we would urge our colleagues in the research world to be doing more work in terms of identifying those needs so we can figure out what programs to start pushing for. And we, of course, need coordinated responses. We're seeing more and more of those across the country with a number of the centers and with multidisciplinary teams of many different stripes. And and also under the Office, the Office for Violence Against Women, under the Violence Against Women Act, has funded a number of coordinated community response teams. So we are seeing an emergence there, but we could certainly use more because all arrows point in the direction of such coordinated responses being among the most effective. We also need some social theory work, as Georgia alluded to. We don't really know what causes a lot of elder abuse, and it's clear that it's a whole lot of different phenomena, and that we should be looking at potential causal factors like power and control, like caregiver stress, like greed, and a number of others. And NIJ has funded some preliminary work in this area, but I think we need to know a lot more to start understanding why elder abuse happens in order to effectively address it.
MT, when you mentioned about the need to identify and promote effective prevention efforts, can you highlight some of, who is doing some of the most innovative type work on prevention research in the elder abuse, neglect, and exploitation context? Do you know if anyone is doing that type of work?
I know about some people who are talking about some ideas, looking to the child abuse and domestic violence areas in terms of what was successful, for example, nurse home visits and that sort of thing. I don't know anybody, I don't know of any piece of research underway right now or conclusions that come to mind. Georgia or Ron, do you have any thoughts in that regard?
Let me try to answer. We get a lot of manuscripts in for the Journal of Elder Abuse and Neglect, and I can say in the last 4 years that I've edited it, that if I have received one or two, it would be a surprise to me with respect to research specifically directed at prevention activities.
Yeah, I would echo that. Prevention and intervention are generally the last things that are funded, and when you have to try as hard as we did to get a very inexpensive, relatively speaking, prevalence study funded, and it took that long, I think those are down the road. Our medical colleagues, however, I think are leading the way, but I've made the argument that that the residential population, the cognitively impaired population, is a very different group that's going to require very different preventive and tertiary interventions. But just to let you know, some work is out there for elder mistreatment, but I think it's focused on nursing home and that type of vulnerable population.
Right. Well, and even in the long-term care arena, they haven't really, I don't know that there's really consensus about what the silver bullet is. I mean, there are some areas of consensus, but I don't know that there's been a broad prevention study in that arena either. So I think in terms of the take-home points here, we desperately need more intervention and prevention research, primary, secondary, and tertiary prevention research.
Can I just add one other thing, MT, and that is, it's almost been a given in the field of elder abuse around multidisciplinary approaches, whether they're in teams or forensic centers or whatever they happen to be. And yet that's another arena that has never been evaluated. We really don't know if that's the most effective way to deal with this problem. We assume it is. It's sort of like almost philosophically it's a given that it is. But it has really not been rigorously tested to know.
Absolutely. And we don't know which kinds of those teams are more effective. Is it more effective if you have X composition or Y composition? I mean, a good example is a fatality review team, which look at unexplained deaths of elders. And for years and years, we didn't have any, although they were in existence for decades in both the child abuse and domestic violence arenas, and in the last decade has seen the emergence of a small handful of those teams. And so there are many different ways that one can approach the unexplained death. And what many of them do and have found more successful, I believe, is to do sort of a systems analysis, say, okay, how did the system work here, how did the system not work, instead of taking to task one member of the team and saying, man, you really blew it on this case. How did you mess up so badly? Because then you're less likely to get participation and less likely to be able to identify where the systemic weaknesses are that should be addressed. But there are a lot of different models, and so it really would be important to start studying some of the different models, not just in fatality review teams, but in all manner of multidisciplinary, interdisciplinary, transdisciplinary teams.
I'd like to second what Georgia said before. The model, the conceptual model of, particularly for community residing adults, of applying a child abuse model as opposed to a power and control domestic violence abuse model is also going to guide the prevention research. And we haven't even decided which model we want to use. For vulnerable or cognitively impaired adults, the child abuse model may well work. Model of both conceptualizing the etiology or cause as well as the intervention or prevention. For community residing adults, where empowerment is generally the key, it's been a hard sell, at least for me, in getting people to think of this along those lines.
Right. I think that's a really important point, and goes to the lump. Are you a lumper or a splitter? Do you put all the cases together? And I think that one area where we do have consensus in the elder abuse field is that we really need to be looking at some of these issues as discrete phenomena. They certainly have relationships to one another, but the kind of issues that are at play in a financial abuse or exploitation case are going to be different from neglect of a profoundly demented person, are going to be different from domestic violence in later life. So we really need to start teasing some of that out and developing prevention models, intervention models accordingly. Okay, moving along, I thought it might be useful to talk about a couple of other pieces of research. One of them that has not yet been published, but some of you may have heard rumblings about it, is a prevalence study in New York State. It looks only at New York State residents age 60 and older. It was a similar methodology to Ron's random digit dialing of about 4,000 people. And the results in that study were that about 1 in 13 people, sorry, I need to move my slides. I apologize. About 1 in 13 people, or 6.7% in the study, were victimized by elder abuse, neglect, and exploitation. And this was Mark Lax at Weill Cornell in New York, head of geriatrics there, who's done a lot of the groundbreaking research in this field, was lead on this along with Jackie Berman in New York. So the rates are slightly different than the ones that Ron came up with, and I think one of the issues that we should face, and one of the issues that this gives us an opportunity to look at more, is how differing definitions are going to count for different rates of elder abuse, or why are we finding slightly different numbers. It might just be that New Yorkers are different too, and that New York is not a mandatory reporting state. I think one of the more impressive parts of the New York research, though, is the vast underreporting that it found. I mean, overall, in all kinds of elder abuse, neglect, and exploitation cases, only 1 in 23 cases is reported. When it gets to financial exploitation, it's only 1 in 43, or almost 44. And in neglect, it's kind of astounding, 1 in 57 cases is reported. So that's really something we need to start looking at, is how much of this is going hidden. So if 6.7% is what we see, then what are we missing? I think it's very important for us to look at the full spectrum, as we've been discussing and alluding to. And that points up some of the issues and limits of using telephone, the random digit dialing methodology, as Ron also said. And these are, of course, different populations and different would be susceptible to different kinds of questions. But if we're saying that this is the prevalence of elder abuse, we need to look at and figure out how to define what it is that we're talking about, because by definition, a phone survey is leaving out some of the most vulnerable parts of the population, people who are unable to answer the phone, people who don't have a phone or phone service, people who are either unwilling to respond truthfully or unwilling or unable to answer the phone because of the presence of an abuser, who are too demented to either respond or answer, or who live in facilities or in other settings. And I tried to add a few numbers here. I hope they're not too inscrutable, but on the inability to answer, it's important to keep in mind that the instrumental activities of daily living are one of the main measures of ability to function and functionality. And yet 19%, almost 20% of people 75 and older have some limitation in IADLs, and one of those IADLs is the ability to use the phone. So that's an inherent irony or bias in the results. The numbers that we came up with in terms of people who lack phone service is that in people 55 and over, about 4.3% of the population do not have phones. I was unable to find any data relating to the presence of an abuser. Right now, in the population 65 and older, 5.1 million people have dementia, and that number is on the rise. And the number of people residing in facilities or other settings is approximately 2.5 million, with about 1.5 million people in nursing homes and about another 1 million in non-nursing home residential care facilities. So that's pretty stark. Now, in terms of what we know about abuse and neglect in those other environments, there are not any real recent data that I was able to find in relating to facilities, except for a Michigan State study that came out that was on the elder abuse listserv yesterday, looking at about 20% of facilities as having serious issues. And then that's pretty much the numbers that were in the conclusions of the GAO and some of their reports in the mid-2000s. And then there's the Centers for Medicare and Medicaid Services staffing study that came out in 2002, which concluded that between 50 and 90% of nursing homes understaffed at rates that are harmful to residents. So I think we have reason to be concerned across the board. And this is just a slide looking at the IADLs, and some of the other IADLs are driving, cooking, shopping, and managing medication. But most relevant to this particular discussion is that using the telephone is one of the measures of functionality. Now, if we're trying to get a broad spectrum picture of prevalence of elder abuse, there's a recent study from the University of California, Irvine, headed up by Laura Mosqueda, that has real daunting numbers. It was a small study looking at dyads of a person with dementia and a family caregiver, and they found that in 47% of those cases there was evidence of elder abuse or neglect. And there's some overlap here in the numbers, 42 experiencing psychological abuse, 10% physical abuse, and 14% neglect. Those are really astoundingly high numbers. And I would echo what Georgia said in terms of not underestimating the importance of looking at elder, of a psychological or emotional or verbal abuse. There was a recent study last year out of Howard University that found that in women aged 50 to 79, verbal abuse took a worse toll on their mental health than physical abuse. So that really echoes the findings that Georgia was talking about earlier. In terms of the policy landscape to try and address this vast issue, from a federal law perspective, there are 3 primary pieces of legislation and then various other bills as well relating to long-term care that I haven't listed here. The Elder Justice Act, as was mentioned, was passed last year, but as yet not a penny has been appropriated for that, and the appropriations horizon looks pretty bleak right now. I guess you all read the paper and watch television. In terms of the Older Americans Act, in the 2000 authorizations, there were a number of provisions relating to elder justice, including a requirement for data collection, various other provisions. those 2006 elder justice provisions were never funded and were never implemented. There are some other provisions of the Older Americans Act that fund the National Center on Elder Abuse and fund the Ombudsman Program and a few other elder justice-related kinds of programs, but it's really very little funding. And as Georgia pointed out, when we were working on the Elder Justice Act, we worked with the Congressional Research Service to look at percentages of funding, and the 2% of monies that go to elder abuse, neglect, and exploitation as opposed to abuse, neglect, and exploitation of other populations is a very, very conservative figure, and in fact, it's quite likely to be a lot lower than 2%. Under the Violence Against Women Act, it has a small but robust program relating to elder abuse. The funding for that is $4.2 million. As Bonnie Brandel, who provides technical support under that program, likes to say, although it's the smallest provision of the Violence Against Women Act, it's one of the biggest pots of money coming into the elder abuse field. So that's pretty stark in terms of the funding. And, you know, part of this goes back to advocacy, and really advocacy and policy are linked. But, for example, when the stimulus package was passed last year, there were $215 million for violence against women issues and zero for elder abuse issues. And I'm not sure that from a policy perspective there was really a push because the issues are, the elder abuse issues are quite invisible. In terms of these pieces of federal legislation, as Lifelong Justice, the new group that I have been working on with Appleseed, we are putting together a legislative map that will be put up on the website hopefully in February. So that will go through some of the different provisions in these federal laws. In addition, there's a huge hodgepodge of state laws. State laws are all over the place, and I don't think it probably makes sense to get into it now, except to say that it makes making policy in this area much more complicated and makes training from state to state complicated. It makes data collection very complicated. And these are issues that have been addressed by other fields. For example, in the child abuse field, they have managed to identify some common data points nationwide on which they collect, on which they've gotten agreement from a number of different stakeholders to collect data. And that's the kind of thing that we really need to be pushing for in the elder abuse field as well, so we can get some better idea of what's going on. Moving along.
Before moving on, Auntie, there's one quick question that came up, and I'm just going to read it because I don't want to do it, you know, as a service. This participant recommended 3 other things worth considering, particularly for community living elders, and those would be victim-centered, women-defined advocacy, especially including advocacy beyond leaving by Jill Davies, trauma-informed care, and expanded continuums of responses, as in differential responses from child welfare field. The reasoning is that the even more complicated and co-mingled relationship due to aging between perpetrators and the victims. The question was whether or not any of the panelists knew if anybody was looking into these types of areas. Georgia or Ron or MT?
I think that Bonnie Brandel would probably be a good resource on this, and possibly the National Clearinghouse on Abuse in Later Life website.
Okay.
The only thing I would add is in Ohio, our Ohio Domestic Violence Network did come together with the Ohio Area Agencies on Aging and basically formed a kind of curriculum on domestic violence in later life, and Jill Davies had some prominent pieces in that curriculum.
Thank you, Georgia.
Great.
MP, one more question for you.
Sure.
And again, I'm just going to read it because I don't want to misstate it. Although there is certainly crossover between elder abuse and domestic and sexual violence, there are certainly differences as well. And I wonder if some of that has to do with financial exploitation, which I found to be so closely tied to all kinds of elder abuse, including an even higher rate with individuals with dementia. Almost all cases reported of elder abuse have a financial exploitation component. I think that might need a very different intervention model. And the person was hoping for your thoughts on that, or any other panelists' thoughts on that.
I agree, and again, this is where we're really hampered by the lack of intervention research and the lack of theory or causal clarification. But I completely agree with what the commenter has to say.
Just to address the co-linkage between the two, and we'll see the NIJ link, and you guys will be able to see the family financial abuse, which I feel more confident about. Family financial abuse was about 5% of the population that we surveyed, 5% of the sample, sorry. And when you look at any form of abuse, emotional, physical, sexual, potential neglect, or financial, our past year rates went up to 15%. And what that means is that in this sample, financial was sort of a different group of people. And again, the differences between the different mistreatment types are generally overlooked, and so we're grouping elder mistreatment as one big thing, but there are subgroups. For example, the rates of abuse vary by gender and by types of abuse, and that's probably going to change when you have dementia or cognitive impairment included. And again, it's going to change when you have considerations for financial abuse. So the thing I've been trying to stress in my talks, and again here I'm hearing each of the speakers is saying it, we're at a very nascent stage because there's almost no funding going here. Because it seems efficient to group everything together, and because we have so few funds that we sometimes are forced to group everything together, I think it's very important that we don't group everything together. It's independently residing adults require a different methodology of assessment and intervention than cognitively impaired adults, and it seems that the prototypic mistreatment types of emotional, physical, and sexual assault require different interventions because they have different risk factor sets than neglect and financial types of mistreatment. So we have to be careful about overarching models. It's nice to have a start, but if it seems too efficient to be true, then it probably is.
I would just really like to echo that. I think it has been long a mistake in the field of elder abuse to keep broadening our definitions and then along with that expecting intervention modes such as adult protective services to take it all on. There is no particular intervention mode that's going to be effectively and capable of doing that. You know, the ideologies and other factors are just going to be too different by type of elder abuse for that to take place, and yet we have consistently gone in that direction.
Thank you, Georgia. MT?
Okay. Let me just very quickly go through some of the challenges we're facing from a policy perspective, and then some of the opportunities going forward. In terms of the challenges, they are many, and we've alluded to many of them. The problem is largely invisible. A good example of that is the O.J. Simpson case was used by domestic violence to galvanize a field and to pass legislation and to really educate a country. And when we had the Brooke Astor case, there were almost no articles focusing at all on elder abuse. And so we haven't managed to somehow leverage opportunities like that. If you look at the federal government, and I can say this now because I'm not there, there are offices that focus on and receive funding to provide development, policy development and technical assistance, resource centers and that sort of thing for child abuse and domestic violence. There's no corollary office relating to elder abuse, although there are the gallant efforts of Andy and Carrie and other colleagues at the Department of Justice and Health and Human Services. There are very few discretionary dollars going to elder abuse. If you look at the National Institute on Aging, the premier research agency on aging issues, I believe is what the website says. That's paraphrasing, that's not exact. They spend about 1/1000th of their annual budget on elder abuse research, and CDC spends even less. NIJ has the only existing federal research program in this area, and there's very little philanthropic or corporate money going in. So there's a reason we know so little, because we're just simply not getting funded, and that makes it much, much more difficult to proceed. Similarly, those on the front lines have a dearth of funding. Adult Protective Services is in many states having to they're having cases taken away from them and just given to Child Protective Services workers or furloughs, et cetera. It's really quite dire. So there are many challenges. Another example is that whereas domestic violence has a high-profile advocate like Vice President Biden, elder abuse does not have a corollary high-profile advocate, which makes it much harder to get traction for policy initiatives. That's the bad news. The good news is that there's important stuff going on. The GAO is about to release a study, we believe in February, that is going to focus on Adult Protective Services. I believe also they're going to look at data and at the elder abuse field generally, so stay tuned for that, and hopefully we can use that as an opportunity to highlight some of the challenges and make recommendations going forward. The Department of Justice, in conjunction with HHS, has funded a concept mapping process that hopefully, will provide a blueprint for the field, and Andy or I can talk more about that if anybody wants to hear about it. There are a number of legislative opportunities in 2011. The Violence Against Women Act and the Older Americans Act are both being reauthorized, and there are ongoing attempts to find appropriations for existing legislation. Advocacy efforts are improving, and there's increased attention and interest in many important sectors, and notably having an event like this. And I think I'll leave it there. I'll put up my last slide, which looks at the translation between and among research, policy, and practice, and what some examples are of where those translations have really yielded important results. And I'm happy to answer any questions about this, but I think I'll leave it there and we can go to the Q&A, and I'm happy to answer any questions about it. Thank you.
Thank you, MT. And with that, we'd like to open up the floor to anybody with questions. I'm happy to navigate and try to direct everyone's questions to the panelists. Meanwhile, MT, do you want to explain a little bit more with regard to your schematic that you just put up while I begin to sort out the questions?
Sure. So what I was trying to conceptualize is what the various interactions are and why it's so important to translate the work that you're doing to the other domains in the field. And I think this call and this webinar is a perfect sample of it. So Ron does a really important piece of research, and if we as people who are interested in practice and in policy don't start grappling with the findings and figuring out what do they mean in terms of applying them, then the research will have had a much more limited impact than it should have. So another example of a piece of research that has an important impact when translated into practice is the bruising study that NIJ, or bruising studies that NIJ also funded, that tell practitioners essentially what kinds of bruising are markers of abuse and neglect and which ones are more likely to be benign. Now, it's not going to give the definitive word on which ones are in which category, but it tells practitioners where to ask more questions. So that's a really great example of translation. Another example in terms of research and knowledge going the other direction is that in King County, they have a very innovative prosecutor's office. The DA's office there is doing really interesting work in interesting cases. And so what they're doing is now collecting data about the cases that they are bringing, and how many, what kinds, looking at victim and perpetrator data to try and get a better handle on what we can learn from their experience on the front lines. from a research perspective.
MT, sorry, one quick question that's come up was with all the recent discussions, and this is a little bit off topic from what you were just talking about, but given all the recent discussion about the repeal of the Affordable Care Act, has anyone voiced the fact that the Elder Justice Act was actually embedded within the Affordable Care Act? And do you know whether or not talk about repealing the Affordable Care Act is aimed at the Elder Justice Act, and would it actually have any impact on the Elder Justice Act?
Well,
any thoughts on that?
You know, Bob Blancato, who is the National Coordinator for the Elder Justice Coalition, is probably the best person to speak to that, but I would say that the good news and the bad news is that very little of the discussion about the Affordable Care Act has related to the Elder Justice Act. It sort of snuck in and snuck under the wire at the last minute, and it was not a very visible part of the act, nor have you heard a whole lot about it. So I think it's not controversial, and it has a lot of support on both sides of the aisle in Congress. That's the good news. The bad news is that you haven't heard a lot about it, because that in turn means that there's less visibility, less ability to generate support, and less recognition of elder abuse as an important policy issue that is deserving of the highest level of contemplation and support and funding.
Great.
Does that answer the question?
I think so. And Georgia, another question for you is whether or not you know if there's been any study about, you know, what correlation there may be between caregivers burning out and what percentage of that ends in homicide, and is there a thought that that number may be sort of on the rise as outside help begins to sort of decrease? Any thoughts on that?
Actually, and Ron also might want to speak on this, most of the research that look at risk factors for elder abuse occurrence do not suggest that caregiver stress and burden is a significant risk factor at all. Rather, it looks at other kinds of risk factors, particularly characteristics on the part of the perpetrators, such as financial or housing dependency on the victim, mental illness or mental impairment, substance abuse, those kinds of things. So,
I'm sorry, Georgia, if I could ask you to speak more closer to the phone.
Okay. The research to date does not suggest viability with respect to caregiver stress and burden as a major risk factor for elder abuse occurrence. In fact, most of the research to date has pointed in the direction of other sorts of characteristics, particularly of the perpetrators, such as mental illness, mental impairment, substance abuse, financial or housing dependence on the victim, shared residence in general, that kind of thing. In fact, maybe an interesting study, and is one that also comes out of the University of California at Irvine, and it was done by Eileen Wigglesworth, I believe it was, along with Laura Mesquita, et cetera. And in that particular study, when they looked, and I think it was maybe the one that, in part the one that MT was quoting, but in that particular study, essentially what they found was significant were looking at dyads of caregivers of persons with dementia and those care recipients that did have dementia, that it was really the characteristics of the people who had the dementia with respect to being, you know, aggressive towards their caregiver, and that sort of thing, that was more significant in terms of predicting abuse occurrence than any characteristic on the part of the caregiver themselves.
Which is fascinating.
And Georgia, that is the same study.
Yeah, I thought so.
We'll put up a reference for it in the materials that go with the webinar.
Yeah, the citing I had was for Eileen Wigglesworth instead of Laura.
Yeah, you're right.
Okay. I want to mention one other thing in terms of what MT was talking about, and cite a study in that regard, because MT was talking about nursing homes, and, she's absolutely right. We haven't done a lot of research that looks specifically at nursing homes. But having been an adult protective service worker myself and administered a couple programs in that regard, I would say, and this also comes out of the New York study that MT cited as well, so often nursing homes are used as protective settings in elder abuse situations. And one really interesting and fascinating study came out a couple of years ago by Connie Page and her associates in Michigan. And to my knowledge, it's the first study that ever looked at elder abuse by paid caregivers across settings. And in this particular study, again, it was done in Michigan, they looked at 3 types of settings of long-term care. They looked at where you had a paid caregiver in the home, and then it looked at assisted living, and then it looked at nursing home care. And basically what it found was that moving from paid home care to nursing home care more than tripled the odds of caregiving abuse and more than doubled the odds of caregiving neglect. And moving from assisted living to nursing homes, although it didn't seem to affect caregiving neglect, it multiplied the odds of caregiving abuse by 5, which suggests how dangerous, in a sense, contrary to the perception of nursing home being protective settings, at least for some people, how dangerous they might be. Now, this is not to suggest that all nursing homes are bad or that the people that work in nursing homes are not caring and supportive, but I think we would be remiss not to recognize that there are issues and concerns in those types of settings that need to be addressed, and all of us have a responsibility around helping to address them.
Right. And if I can just make one follow-up point to that, which is that regardless of what the actual quality is of nursing homes and non-nursing home long-term care, there is such fear and reluctance to go into a facility because, for any number of reasons, that people stay at home in very abusive and neglecting environments often to avoid going into a facility. So in fact, just the fear of them can increase the incidence of abuse and neglect at home, which is one of the reasons that I think that we need to look at the phenomena across the spectrum of settings and can't look at it isolated in just one environment.
Thank you, T.
I'll go ahead.
Go ahead, Ron.
Just to add to that's not the topic of my area, which is community residing specifically, but Dr. Lax has a very important study that shows that if you really want to stop nursing home-based violence, then the caregivers are not the people to really focus on. If you had to pick one area, you really, and of course you need to focus on them as well, but I'm saying your best bang for the buck would be to make the environment safer, because resident-on-resident violence is much higher by a factor of 10 to 20 than caregiver on resident violence. So it's an actual environmental structure of dangerousness, and he did that with time sampling cameras and that methodology, and found that, boy, our focus was a little misplaced. And again, that's not the topic of this talk, but really we have to look at the whole picture and not get too stuck in models when we don't really know exactly what the numbers are. And so that would be speaking to, we need to make these residences safer from each other rather than from the caregivers as a first step.
And I would just like to add something to that. I totally agree with you, Ron. But to add something to that is, this was a while back. I think nursing home settings are just very volatile, and that the potential of abuse can go every which way. Linda Vinton, some years ago, for example, did a study up in Wisconsin where she looked at the incidence of family members being abusive to staff in nursing facilities. And I believe within about a 6-month period of time, she identified more than 1,000 instances of when that occurred. Everything from, verbal abuse to hitting. And at least in her particular study, the primary perpetrators of family members were wives and daughters of the residents. But again, the violence was against the staff themselves. So, it's just a very complicated, it's a very volatile setting, and despite the good efforts of many people within them, it still goes on.
Dovetailing somewhat with this discussion, one question that came up was whether or not we think imposing mandatory reporting requirements would have any impact on elder abuse or neglect in the institutional setting. That question came from a colleague in Australia, and I was wondering whether or not the panelists have any views on whether or not that would have any impact, and if so, what that impact would be.
In some places, mandatory reporting already exists. To my knowledge, and MT's probably more informed on this than I am, about half of the adult protective service programs across the country deal not only with community-based or domestic elder abuse, but deal with it in institutional settings. And most all places, obviously New York is one of the exceptions, but it's a rare exception to have mandatory reporting. A couple studies in the past have dealt with what's more important. Is it mandatory reporting, or is it other kinds of things? The GAO study dealt with that. Research by Rosalie Wolf dealt with that. And in both of those instances, other factors than mandatory reporting seem to be more important in bringing about referrals of elder mistreatment. And the kinds of things they found to be more important were things like professional training and public awareness activities, the agency receiving the reports having a good reputation in the community and people believing that they will be appropriately responsive to the report if it's made, that kind of thing.
George, did you know whether or not there's ever been any study to track whether or not mandatory reporting requirements have any direct identifiable impact on the level of elder abuse that takes place in an institutional setting? Does it have a deterrent value at all? That they have to report it?
Any that was particularly directed at a nursing home, but maybe the others have.
No, I don't think there's been any research to that effect. There has been in the younger adult field with respect to domestic violence. And again, you have to separate out populations. We currently have, in most states, mandatory reporting of violence and mistreatment against vulnerable individuals, be them adult, older adult, or child, and that's often defined by disability or cognitive impairment, if not age. And that a lot of times is in place. What's really an interesting question is, would it help if that were extended to independently residing or cognitively intact adults? And then you sort of are attacking personal rights, liberty, and empowerment for the interest of self-protection. So there has been a study, actually, that compared and contrasted mandatory reporting of domestic violence in younger adults and compared to those places that didn't have it. And with all the encumbered difficulties in doing that with non-random assignments, they basically found out that in some cases it increased the violence, and in other cases it decreased. It was protective, but overall it was a wash, and there could not be a strong justification for it. And I would bet that that would sort of hold with the older adults. There is a tremendous risk, I think, in doing more damage than good when somebody who has personal liberty and has decided they don't want outside people involved, if you don't respect their right, I guess, to be mistreated. On the other hand, if the mistreatment is chronic and they're not realistic in terms of their protection, then maybe you could help them. But this has not been studied in older adults in any significant way.
Right. just to add to that, the GAO study that Georgia made reference to, I think, came out saying that there isn't good evidence that it is effective. There's a pretty deep divide in the field about whether or not mandatory reporting is good. And I think it lends itself again to the we need more research on it point, and really need to get a handle on whether this is something that we need to be pushing for. The one thing that, one compelling point that's been made about mandatory reporting is that if you are a mandated reporter, it's more likely that elder abuse will be a subject in whatever training that you have in your professional life. So there is a nexus, I think, between mandatory reporting and training, which is not maybe the primary intention of it, but is an important possible side benefit. Lori Stiegel at the ABA Commission on Law and Aging has done compendia about mandatory reporting laws. So if you go to the website on the ABA Commission on Law and Aging, you should be able to find those, and we can work with Jim to post those as well.
I just want to go back to what Ron was saying in terms of, how, in fact, risky it might be to take away the rights of an older person with respect to interventions. And there is a kind of infamous study that was done a long time ago that sort of underscored that. And the study was done here in Cleveland at the Benjamin Rose Institute. And again, it's almost an infamous study. And it was done by Margaret Blankner and her associates. And Benjamin Rose Institute at that point in time was one of about 7 demonstration projects to, in a sense, develop the concept of adult protective services when it was just being talked about as an intervention for neglect and exploitation around the country. And it was a rigorous study in the sense that, I can't even believe it because I worked there for 10 years, but at that point in time, the board of trustees of this very large not-for-profit organization decided to treat everybody coming in the door, and it's an aging-specific service organization, to treat everybody coming in the door that met certain characteristics and assign them either to a random, assign them randomly either to an experimental or control group in terms of the receipt of protective services. And then they followed them over time. So the experimental group received adult protective services. The control group did not, even though their characteristics were similar. And what they found in this particular study was that those that received adult protective services were more likely to be institutionalized and die. And the belief was it was around the loss of freedom and the loss of self-determination. And in fact, for that reason, by the time in the mid-1970s into the early 1980s, when they began to develop adult protective service laws and really solidify across the country adult protective services as an intervention modality, they reversed things. So they put a lot of due process and other protections of the rights and responsibilities of adults in those laws, and largely in the aftermath of that particular research.
Thank you, Georgia. It appears that we're sort of winding down a little bit in terms of the number of questions coming up. I was wondering if any of the panelists wanted to make any closing remarks or observations.
I'll make a quick one. Despite the fact that we're really underfunded and backward on models and etiology and causes, we do have one sort of metacognition or meta-finding from the older adult literature that, again, is sort of common sense, but it speaks to interventions. The more we can connect people to their social environment and to their community and to other people, the more we can protect them from elder mistreatment and the negative psychological and probably health consequences. We don't necessarily know exactly how or why that works or exactly what's best, but we do know that this is a group for whom social connections are rapidly diminishing as you age because your friends and family die. And so your risk factor increases, and we know that transportation is a giant problem. So programs that help elders by transporting them to social venues could do this as an initial first step. That's really an overarching thing I'd love to get out there because these are very easy to implement. NPR 3 months ago outlined a college student program where the whole deal was to get college students to help drive seniors who don't drive or don't feel comfortable driving or after dark out there and doing things. And it has effects that they don't even know about, but that's the type of thing we can do quickly.
Ron, is your study, can we use it as a source for looking at the efficacy of different types of social interventions, or is that an area where we need more research before we can speak authoritatively?
I think my study was just an initial snapshot study. As Carrie Mulford knows, I was screaming for many years, let's forget about theory for a second and just start counting and see what we have. And so it was really an initial snapshot of risk factors, perpetrators, and prevalence. It gives you a start point. I don't think it gives any idea as to outcomes yet. As a matter of fact, the study begs the question, okay, these events happen, what are the outcomes? Health and financial and mental health. We don't have those data yet, much less intervention programs. So I think it's really, my study gives you just a snapshot. I don't think it's all that informative with respect to what's going to work. It does say what might work, but not what's going to work.
Which actually goes to another really critical issue in the field, which is when we say what works, we don't even have a definition of success because it's a very heterogeneous population, and different people are going to have different definitions of what is success. For one person, it might be if she is left alone, even though she's self-neglecting, and, you know, if everybody goes away. For another person, it might involve more intervention. And so I think one of the central challenges we have ahead of us is to define what is a success, what constitutes success in terms of an intervention. And then another really central issue I think that we need to start doing a better job addressing is what are the costs? What is the cost of elder abuse, and then what are the cost savings? Because to the extent we want to make more coherent arguments in policy arenas, we're going to need to get a handle on those numbers. And the numbers from our colleagues in the child abuse and domestic violence field are astronomical. The numbers, the estimated cost of child abuse annually is $100 billion. And it's in the many billions of dollars, in the believe it's the $60 to $70 billion range for all kinds of domestic violence, and in the lower range around, I think, $6 or $8 billion for intimate partner violence looked at alone. So it's really, I think it's really important that we start to pay some attention to that, which actually also brings up one other important point in your study, Ron, which is the difference between partner violence and violence by family. And I think in working with our colleagues in the domestic violence field, it's really important to articulate that although some people think of mostly partner violence when they think of domestic violence, in elder abuse, it ranges, the range of family members is much broader.
Yes, and adult family member violence against adult family member violence is a form of domestic violence. It's two independent adults. It doesn't necessarily have to be marital violence to be domestic violence.
I guess the parting thing I would like to offer is, in a sense, going back to what NT was referring to, and she identified three primary public policies that impact elder abuse. And what's notable about each of these policies at this point in time is that all of them, in a sense, are sort of up for grabs this year. And we're talking about the Elder Justice Act, which has not been funded but has been passed. We're talking about the Older Americans Act, which is in its I believe it has been reauthorized 16 times, and it's up for reauthorization again. And the Violence Against Women Act, which is also up for reauthorization this year. This is a time for all of us interested in elder abuse to galvanize our advocacy efforts around ensuring that these acts not only remain in place and are appropriately funded, but they are responsive to the understanding about elder abuse that's coming out of research like Ron's, and therefore is reflective of the kinds of changes that need to happen in those acts to better take into account the findings. So I do think it's an advocacy opportunity. It's one that all of us should be involved in, and it's clearly current this year.
Thank you very much, Georgia. Jim, I think you wanted to mention something about the slides and the recording.
Yes, thanks, Andy. First, let me just say on behalf of the Harvard Kennedy School, thank you so much to the audience for participating today and to our panel for participating in this great discussion, and especially to those of you who braved the elements to make your presentations today. I really appreciate it. And as I mentioned at the start, we're going to be, we have been recording this session, and we'll be posting that recording on the Government Innovators Network website in 2 to 3 business days. You'll receive an email when that is posted. At that time, we'll also have the presenters' slides posted pending their permission. And I'll be updating the resources page so that we cover all of the resources that were referred to today if they're not on there already. And I know that many of them are not, so that's another thing to look for early next week, is that we'll have many more resources on that page.
Great. Thank you very much, Jim. Thank you, panelists. If there's nothing else, I think we'll be adjourning the webinar then. Thank you.
Thank you so much.
Thank you. Bye-bye.